Join me, Mark Windows, for Windows on the World live every Sunday 9 to 11 p.m. GMT. Check out our archive and programme stream at windowsontheworld.net. Good evening, everybody. Welcome back to Windows on the World. This is our second show in the series, World Government Declares War. Do have a look at our previous show. Also have a look at our previous show before that, COVID-19, Babylon's Business Plan. And the show that preceded that was called The Globalist Mind Virus. Now, we've been reporting on this pandemic for the past four weeks, and we've come up with some very interesting conclusions, and they're all in those shows. Basically, what we've got here is something that was rolled out on the back of a computer model. I'm going to be talking to Piers Corbyn about this computer model that was rolled out through Imperial College in London by someone called Neil Ferguson. Now, we've already made all of the associations quite clear between the organisations involved in this, including, of course, the World Economic Forum, the United Nations, the Johns Hopkins University, which rolled out the actual practice run for this, which was called Event 201. We have the Bill and Melinda Gates Foundation ready and waiting in the wings to supply the vaccination, which has been invested in by the United States government and also the UK government to the tune of 210 million for the UK, but it's a $12 billion project. And this is all part of the thing we call sustainable development. Yeah, we talked about all that in the first part of the show. This is a little add-on, so I'm not going to get too much into all that. I'm going to welcome Piers Corbyn, weather forecaster from weatheraction.com and no stranger to this show, to talk about this Imperial College London document and the rollout of what is in effect a computer program. So the reason that you're locked into your house, the reason your neighbours are snitching on you for walking the dog, and the reason you've been queuing up at the supermarket and standing 6 feet apart is in no small part due to a computer model from Imperial College London, which was taken on by the UK and the US government. So those people who are perceived to be in power are taking their instruction from people who, it appears, don't know what they're talking about. So, Piers, welcome to the show. And yes, let's get into this report from Imperial College.
Okay, well, it's great to be here again. I am, of course, a graduate of Imperial College some years ago. And I would say that the model they used, well, was probably of the highest quality as a model, but the inputs, you see, are open to question. And I think there's two points to note. One is, why did the government just rely on this particular input and models rather than other ones? Because there are quite a few around saying different things. And the second thing is, why was it reported in the way it was by the media? Because Neil Ferguson, when questioned later, said, oh, no, it might not be 500,000 people dying. It might be only 20,000 or even 10,000. And when he was pressed on this, he said, well, this possibility was implicit in the document. Well, it may have been, but only if certain probably different data was put in. And then he said, well, of course, it will be lower if all these measures are taken. So whatever happens, you see, they will say, well, it's lower because of the measures or something like that. Now, the inputs, you see, are very open to question because, you know, you've got to have an assessment of how much each person who gets a virus passes it on. That's one thing. And the other thing is the percentage of people who are going to, get seriously ill once they get hold of the virus. And this depended on early data, much of which was questioned by many people. So it seems to me that was put in. And so we've got this situation. However, when the government decided to adopt it, one can only presume they deliberately chose if they realised there were options, they deliberately chose the most dire circumstances. and the media publicised the most dire circumstances, therefore justifying what they've done now. But you see, if Neil Ferguson had come on TV and said, oh well, if we do some measures this or that, there'll be 20,000 people dying. Well, that is really nothing different from a normal flu event anyway. So I think, you see, you have a number of interest groups around the government who are making sure that the most severe scenario was adopted, and therefore this massive lockdown, and this is the thing that's happened around the world, because the Imperial College report was not just used in the UK, it was also used in America and referred to in some other countries, although some other countries were surprised at the sizes and said so, but nevertheless carried on with what they were doing.
See, in this document, Piers, it says the COVID-19 pandemic is now a major global health threat. As of 16th of March 2020, there have been 164,837 cases and 6,470 deaths confirmed worldwide. That was then. Global spread has been rapid, with 146 countries now having reported at least one case. Now, the point is about this is that the diagnosis of this virus is very vague. In other words, it's like the diagnosis for any seasonal flu virus. Now, I think that there has been a more serious strain, but the whole point of this is that if you look at this document, to actually base a rollout over the whole world and the economic meltdown that's ensued, the loss of all our rights in this new act that the government have brought out, what you're saying seems to indicate what I've been thinking and looking into, because all of this is interconnected and it all seems to be led by an agenda. In other words, yes, fear, 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 virus,
Correct.
death, virus, death. Yeah. Do you want to pick it up from there?
Yes, because these governments, they can look at any report in the way they want and get the media to spin it the way they want, and that's what they've done on this. So they were standing ready to implement this monstrous crackdown on our rights. And I think there's a lot of ignorance, obviously, among the public about what is a danger and what isn't, because the fact is that in the United Kingdom, 1,700 people die every day from something or other. And most of these people who die are people who are ill with various pre-existing conditions, and they're in hospital. So, and when you look at the numbers of people who died with COVID-19, it's reported on a regular basis that almost all the people who died had a pre-existing condition or were very old. And a couple of days ago, it was the case that all except 4 had pre-existing conditions, and the 4 who died who didn't have pre-existing conditions were all aged over 81. So you see, to call this something which is threatening the public as a whole is actually essentially invalid. Now, they're busy counting the numbers of deaths each day and how much is each day. Well, until we get at least above half the normal deaths each day, then you can just say that this COVID-19 is not something particularly unusual. I mean, it is bad to have it, that is absolutely true, but it's nothing like the Black Death or anything like that. So I think what's likely going to happen is these numbers will, when you get halfway to 1,700 or 2,000, when you start getting 1,000 deaths a day, then the numbers the following day won't be as high, and it'll start tailing off, you see. That's what I think will happen. Or governments will try and fiddle the figures and make all sorts of claims which aren't true. Now, there have been reports from different countries, which you may have covered, that some of these hospitals seem to be relatively empty or completely empty when they're supposed to be teeming with ill people. So I can't comment on that because I don't have the facts, but I do know people inside the NHS say that they're waiting for more. They're waiting for the peak. Well, obviously they are waiting for the peak, but I get the impression that there's less people coming in than was actually expected. Not to say there won't be more, but the media are hyping up the situation, that is for sure.
Yes, and once we look at the global players involved in it, which I've been doing over the past couple of weeks, do please look at those shows because they're full of information.
Yes.
And you can check it all out. And really, this ties into a much bigger plan, and it goes along with the basic plan of action, which is to restrict travel, to destroy people who are self-employed, make everyone dependent on the state, on universal basic income. The model seems to be very similar to the Chinese model, and the hive housing, the smart cities agenda, the control and management of all population, and the vaccination for all are things we've been talking about a long time. And this seems to coincide and bring in all of the above and more. But what I didn't expect was that seasonal flu would be the excuse for basically a coup which has taken over the government, and we now have a martial law situation where no one's allowed out of the house, and we've got a whole new Stasi of useful idiots who are working along the trained change agents and useful idiots to basically shop anyone who doesn't go along with the narrative. That's what's worrying about this. And we've turned into...
Well, it is. I agree with that.
Yes, go on. Yeah.
Oh, sorry.
No, carry on, Piers.
Okay. I got... Okay, yeah, thank you. Two things come to mind. One is, of course, they obviously wanted to do all this under the cover of man-made climate change. So at the end of this virus issue, if there is an end, then, of course, what will they want to do with the man-made climate change issue? I don't know, because it'll take a relative backseat, I would have thought. That is an interesting thought. And the second thing is what's happening up above, because, of course, there's certain globalists like Bill Gates, who suddenly resigned his position in his company. Those people, of course, have a certain agenda, and they are, part of a cabal which wants to implement these monstrosities we see before us. But there are some people in high places who are resisting this sort of thing, one of which is, I would say, Donald Trump. So, you see, Donald Trump, in response to the virus, has mobilized the army to run America. But at the same time, one would have thought he might indeed be doing this in order to, contain or arrest certain criminal elements, amongst the globalists. So it could be that what we're going to see in America is something quite surprising and some sort of conflict at a high level with the super rich cabal being attacked. I mean, possibly being replaced by a different super rich cabal. Who knows? But I think that there's a lot more to what's going on than just the virus, obviously. And you can see, apart from whatever Trump might do, which I think we should watch very closely, there's people like Tony Blair popping up, using this as an excuse to say we've got to delay Brexit, and also reinforcing the usual stuff about more control, vaccinations, and so forth. So there are, there's interest groups all over the place who will jump into the COVID-19 story and indeed carry on making it into a bigger story than it really is, because it suits their interests.
Yes, it's what they call a beneficial crisis. So they created a crisis and it's a beneficial one.
Yes, that's right.
But who would have thought?
Right. Well, everything they do, of course, is beneficial. Yes, it's for your own good. You're being locked up and so forth.
Absolutely. So have you got anything else on this, Piers, that you'd like to share?
Well, yes, I don't know. I've been thinking quite an interesting set of coincidences somebody pointed out to me recently. They said, look, if you take the initials of Donald Trump, DJT, D is the fourth letter of the alphabet, J is the 10th, and T is the 20th. Well, if you write that down, you've got 4-10-20, which is the 10th of April in American date speak. So, well, I don't know. What's for the 10th of April? I'm sure Donald Trump would like to do something then which would boost his persona. And another thing of really perhaps just passing interest, but is fascinating from my point of view, is that if you go back, someone pointed this out to me, every 18 or 19 years, you find a world crisis or a British crisis of astounding proportions. For example, if you start in 1926, we had a general strike. Then 19 years and 3 months later, you have the Hiroshima bombs. 18 years and 3 months later, you had the assassination of John F. Kennedy. Another 18 years and 10 months, you got the AIDS crisis. Add 19 years and you get September 9/11, 2010. And add 18 years and 8 months to now, and you get to April the 1st. So this is kind of fascinating stuff. Whether it means much or not, I don't know, because you can always find something which is serious every 19 or whatever years. However, this period does coincide with the a lunar cycle, namely the it's an eclipse cycle relating to the motion of the nodes of the moon's crossing of the Earth's orbit. That is where it crosses. They're called nodes, and that has a period of 18.61 years, which is really rather interesting. So this may obviously has weather implications. If it's got implications on human behaviour, I don't know. But anyway, if you believe in this sort of cycle, then of course there's a big crisis due, and we are certainly in one.
Well, it certainly appears to be the case. So you're studying numerology now, are you, Piers, as well as your your sky watching?
Numerology, but I'm studying. Studying. Well, Sun-Earth relations, and of course you see the connections between the Sun and Earth are magnetic, and we are magnetic and electrical beings. So, there are connections between human behaviour and what the solar wind and the magnetic activity of the sun are doing. So, this is just a very interesting observation. I'm not saying people should base their well-being on it. They should obviously keep out of getting anything which would make them ill and defend your rights, because you see our rights have been taken away. And we have to, one, ensure that the draconian things are never implemented anyway in this thing. And secondly, that this act is repealed as soon as possible and we can return to normal.
Yeah, very good points there, Piers. Do look at our last show, World Government Declares War, which it effectively has done, on the back of a flawed computer model and obviously a few more players, which we've been talking about. That's it from this section of the show.
Yes.
Yeah, thanks a lot, Piers, and I'll catch up with you in the next couple of days.
You.
That's it for this section, everybody. Do look at our main show, The World Government Declares War, and look at our previous shows in the archive at windowsontheworld.net. Do try and join us for RBN, that's Republic News Broadcasting, Republic Broadcasting News Network, on 7 p.m. on Tuesdays and 7 p.m. on Thursdays. It's a really interesting show, that, getting the American perspective. And we're here every Wednesday and Sunday. So that's Tuesday, Wednesday, 8 p.m. on... Actually, no, let's change this now. I was asked last week to make it later, so the Wednesday show on YouTube will now be 9 o'clock. It'll be 9 p.m. on a Wednesday, 9 p.m. on a Sunday, 7 p.m. Tuesday, and 7 p.m. Thursday. So that's it from this part of the show, and thanks to Piers Corbin, and we'll see you all very soon on Windows on the World.
Join me, Mark Windows, for Windows on the World live every Sunday 9 to 11 p.m. GMT. Check out our archive and programme stream at windowsontheworld.net.